studio is GP Dr. Helen Wall. Morning. Helen. So, people who didn't know about this will have learnt a lot from watching that. And at the beginning, we said this is now available being the key word, for the first time on the NHS.
Yeah.
You're a GP. Is it available?
It's not widely available yet, that's for sure. And actually, if you look at the NICE guidance, which came out in 2020, they were very clear that this should be used in very small set parameters, more of sort of a trial rather than anything. So the evidence for short-term weight loss is OK, but we don't know what the long-term effects are. You know, people will have this in for 4 months. But I rarely meet a patient that obesity is a simple thing. It's always a complex thing of, dietary information, psychological need. There's got to be a full package around these kind of treatments, because otherwise you may lose weight very quickly, which might be helpful in the short term, but actually is it going to help them longer term?
The thing is, this is being seen as a perhaps less invasive, temporary option than having your stomach stapled, for example, bariatric surgery, being cut. If it does become more widely available, what is the process if someone is struggling with their weight, struggling with eating habits, and comes to see their GP?
So we would always, first of all, need to know what their BMI is, and there's always set criteria for referral into these services.
This is body mass index,
yes,
isn't it?
body mass index. So the body mass index to have surgery is 40, and or 35 with other health conditions that are putting you at risk.
Which is twice what it should, twice what it's recommended, isn't it?
But we would need to refer into a weight management service first, which usually involves a full package of psychological support to deal with the relationship with food, nutritional support, advice around diet, and you'd usually have to show some commitment to weight loss. So you'd usually have to start losing weight on your own basis before you would proceed to that. And it's usually a last resort. And it's great for people who need to get to that point. But what I sort of don't want to do is say that this is sort of open to everybody, because I can imagine there's a lot of really desperate people watching that, feeling like this is the answer that they've been looking for. And we won't be able to just refer everybody to have this really simply.
Yeah, so you're talking about desperate people there looking for answers.
Yeah.
In the previous report, a moment ago, we saw people going overseas. Taking advantage of operations and things that can be done elsewhere. Have you had sort of experience of people doing that? You know about this?
Yeah, I've had quite a few patients do this, and it is very hit and miss. Some patients will get on really well with that and be thankful, and some patients do have complications. And I think it is, as they said in the VT, a little bit wild, wild west. We're not really confident. When a patient tells me they're going abroad for weight loss surgery, I do feel quite nervous for them, because we don't really know what the regulations and what procedures they're going to have, who's actually doing the surgery. As they said here, it's so expensive because we use the best consumables, we use the best staples, the best products, best surgeons, and it's just, we just haven't got that certainty when someone steps outside of the UK for that.
The fact is that obesity is an issue in the UK, around the world, okay, in Western, particularly in developed countries, I should say. There is a problem, and people feel pressure. Desperate is the word that has been used on this sofa. So what can be done if people are hearing these scare stories, and rightly so in some ways, with this wild, wild west of surgery, what should be done more, in your opinion, that one would ease the load on you, GPs, but two would make it easier for people to lose weight or not even gain the weight in the first place?
I think we need to start with the basics. Food needs to be more widely available at cheaper pricing. So a lot of the food that is cheap is not good for you. It's high calorie, it's dense in calories. I would love to be able to refer people for exercise programs as a GP. We've done that in the past, but we're not able to do that currently. Some areas maybe, but it's certainly not widespread. So I think if we had more access to the basics, that would help. But also, these services that we refer into, these weight management services, they have long waiting lists. And people, by the time someone comes to me, they are desperate. And I really feel for them. And I want to be able to say almost, here's a pill and it will all get better. But I know that's not firstly, I can't do that. And secondly, it's not going to help them in the long term. Because if you have a procedure like this, I've seen many patients where they then put the weight back on further down the line, because what we haven't done is got to the bottom of why the weight is so high. Is it dietary? Is it education? Is it a relationship with food? Because a lot of people use food to regulate their emotions, and that's not going to get better by a surgical procedure.
Helen, thank you very much. Dr. Helen Wall speaking to us this morning.
Thank you. Just after 9:30, Ed Larkin, a stage actor